Hey guys, this is Dr. Brenden Cochran from Interactive Health Clinic, and I wanted to comment a little bit on the quote deadly Wuhan virus that's you've heard about probably in the news and the media. Media has been doing a pretty good job, I think, of scaring a lot of people lately, and I wanted to put it in perspective and also give you some tips on things that you can do. So this specific virus is nothing new. It's been around actually and known about since some of the mid to early 2000s. We just haven't seen it, come out and also be able to pass from person to person. So one of the things with the death rate I wanted to kind of give you perspective of. So far we've had around 2,000 people that have been confirmed, and then we've had a death rate in the 50s. To give you perspective of what the common influenza virus does that we get, called the flu, usually it takes about 6,000 people per year. So 6,000 people in the United States alone per year die of the flu. Let's put that in another perspective. 300,000 people per year die in the United States due to medicine, due to us, doctors, either incorrectly prescribed medication or a complication for a simple thing like a hip surgery or knee surgery, going under and not waking up. Unfortunately, those are some of the staggering statistics. So I just wanted to put that in perspective of the deadly Wuhan virus to calm some of your nerves. The other thing is it's passed very similar to what a cold and the flu does. So what that means is to protect yourself, the same precautions. Cover if you're sneezing, stay out of public places. If you are sick or feel sick, wash your hands, wash your face, don't touch your face, and do everything else that you would do to keep the cold and flu off of you. And if you haven't seen on our blog post and in our office, we kind of have these tips to support you through the cold and flu season, what we recommend to do. And it'd be the same thing. Now, what are some top agents that we know do have an effect on supporting the immune system specifically for this virus? Well, one of them we know is elderberry. Elderberry syrup, we've commonly used it in flus, we use it in colds, and it does seem to be effective in this specific virus. Some of the studies that have been done on elderberry in this specific virus do show that it tends to work better in the early stages. So if you are taking that more routinely this time of the year, it keeps that virus away from you, it keeps the colds, and it keeps the flus off of you as well. Another big one that we like that has been known in the flu is colostrum. Colostrum shows great benefit with people who are trying to getting exposed to the flu virus or the cold virus, and this one as well. Now, one thing you have to know about colostrum is derived from dairy, so if you're dairy sensitive, it may not be an option for you. We have several other things that were listed on that sheet. Again, it's in our blog post if you search through, or we have it in the office, kind of a sheet for cold flu preparedness. If you do come down with something like this, again, it is important that somebody attends to you, because the biggest concern that we have is this thing running into your chest and causing pneumonia. And so most of those deaths that we are seeing are being seen in the elderly and the immune compromised individuals, just so you're aware as well who it's affecting the most. Now, some of the higher interventions that we do use in our clinic for this, and we commonly find people that are getting these throughout the cold and flu season report that they are not getting sick when everybody else around them is getting sick, is we use IV nutritional therapy, specifically vitamin C therapy. We also use ozone in our clinic, and ozone therapies in our clinic to stimulate your immune system to keep those nasty viruses off of you. If you're interested in more of this material, schedule a consult with us. Remember, we do have acute visits, we have chronic visits. See one of our doctors and we'll be happy to see you.